departure of Paul Johnson. And last week the province announced the proof of vaccination verification status to access certain businesses and settings, which would be in effect as of September the 22nd, 2021. Hamilton City Council and the Board of Health have been advocating for the province to institute a vaccine verification program since early August. We are at a pivotal point in the pandemic, and we must work together as a community to support one another and local businesses to stop the spread of the COVID-19 virus and that Delta variant. So our COVID-19 vaccine verification program will protect the health and safety of residents and will protect the businesses as they work to recover from the last year and a half of all of the challenges that we've had to face. So requiring proof of vaccination will reduce the risk and is meant to encourage everyone that is eligible to get their vaccine as soon as possible. We must be decisive in our actions as we face the Delta-driven fourth wave. Locally, we want to have the highest level of protection possible for our community. So the good news, the past weekend, 544 people received a COVID-19 vaccine at the CF Lion Ridge Mall pop-up clinic. Excellent opportunity for people to get vaccinated as they do their back-to-school shopping. And we want to thank Liam View and Lion Ridge Mall and Cadillac Fairview for their offer to put a location there very successfully. And of course, we want to thank all the public health staff that made it such a successful event as well. They continue to work hard at all of our vaccination clinics to ensure that people have a quick and efficient and hopefully pleasant experience as they get their vaccine. So our entire healthcare system continues to make that big push to increase vaccination rates right across all areas of our city. And you right now can walk in or schedule an appointment at your convenience at any of Hamilton's clinics, some of the neighborhood mobile pop-up clinics, and there will be many, the primary care-led clinics that are happening, plus 100 plus pharmacies offering COVID-19 vaccines throughout Hamilton. So lots of opportunity and lots of choice for you to get your vaccine as soon as you can. On that, I'll pass it over to our city's Emergency Operations Center Director, Jason Thorne, for some local updates on impacts of COVID and how that's going to affect services. Jason?
Thank you very much, Mr. Mayor. And I do just have a few very brief updates today from the city's Emergency Operations Center. At this time, we do continue to be in step 3 of the province's reopening framework. But as the mayor mentioned, last week, the province announced that proof of vaccination status to access certain businesses and settings would be in effect as of September the 22nd in an effort to protect the health and safety of residents and businesses as they work to recover from the pandemic. We as a city are currently reviewing any impacts that may have to city programming and city facilities. We do expect some provincial guidance next week on the regulations, which will help us to further analyze how we can comply with those regulations. As everyone knows, part of our exit from step 3 is tied to our vaccination rates across the province. And I know Dr. Richardson is going to talk about that a little bit more in a moment about what we're doing in the city to raise our vaccination rates. With respect to the city's vaccination verification policy for city employees that I spoke about at our last media briefing, that policy was approved by City Council on August the 26th. As a result, effective September the 15th, all city employees will be required to provide proof of their vaccination status. Those who do not will be required to attend a mandatory education session on the benefits of vaccination. And employees will then need to provide proof of their first dose no later than September 30th. And as of November 1st, it will be mandatory for all staff to have received their first and second doses of the COVID vaccine. We felt that as a major employer in the city, we had an obligation to undertake all the necessary precautions to protect our workforce, their families, and the community as a whole. We have had employees starting to submit their vaccination verifications. We've already received close to 25% of employees responding in just the first few days that we've had that policy announced, and a week ahead of when the deadline is coming. We're also continuing to work with our union partners and working through the details of the COVID testing and education sessions for those who do not submit vaccine verification. A quick word on our fall recreational programming. I know lots of our residents and their families are finding it important these days to get out and stay active as much as possible. So I wanted to advise that registration for the city's fall recreation programs start next week. on September the 15th and 16th. And there's more information about how to register as well as a full program schedule on the city's website. And finally, with respect to enforcement, the city's COVID enforcement team laid 26 COVID-related charges over the weekend. 14 ROA charges were laid at various restaurants, food marts, hair salons, hotels, and other businesses. Officers also laid 4 physical distancing charges, and 8 face covering charges were laid at 7 different businesses. So with that, I will turn things over to Dr. Richardson.
Thanks very much, Jason. So today we do unfortunately continue to see high rates of COVID-19 in Hamilton, although we're hopeful that we may be approaching a plateau. We had a total of 149 new cases since Friday, September 3rd, over the 3 days of reporting. And our activity levels continue to be at a 7-day moving average of 61 and a weekly incidence of per 100,000 of 72. Our highest numbers continue to be amongst those under the age of 59, but especially so amongst those that are 18 to 39 years of age. The average number of new hospitalizations as well continues to be high. There are just over 4 new hospital admissions each day due to COVID-19. Fortunately, though, the number of deaths is remaining low. Our percent positivity continues to be quite high as well at 7.1%. We have 19 active outbreaks on the go, 5 new ones added just today. And starting tomorrow, you'll see on our website that we will begin reporting weddings to the city's status of cases dashboard. There are currently 3 outbreaks that are linked to weddings, one at the Waterfront Centre, one at LaUna Station, and one at Galileo Gardens. So each of these we do investigate, complete with contact tracing. The Waterfront Centre outbreak is being declared over effective today, and new information will be posted tomorrow. This is consistent. The wedding outbreaks are consistent with what we're seeing, which is in the types of facilities such as restaurants, bars, these kinds of banquet events. There are areas where people are taking off their masks to eat or drink. They may be dancing, they may be doing more socializing. And then we do tend to see increased levels of transmission. And as you know, this is why vaccine verification is looking particularly at these areas. So even with vaccine verification, it's absolutely critical that we continue to follow that public health guidance to get fully vaccinated, but also to continue to wear a mask as much as possible in any of these sorts of spaces in order to prevent transmission of COVID-19, and particularly the Delta variant. From a vaccine perspective, we are making good progress. We're now at 80.6% of Hamiltonians born in 2009 or earlier having had a vaccine to date, and 73.3% are fully vaccinated. We were very pleased to see that we had hit that 80% mark in terms of eligible Hamiltonians having received a first dose. You do know, though, both here locally and provincially, the goal is to reach over 90% having both doses of their vaccine. And we're very hopeful that the new proof of vaccination measures will help to increase those vaccination rates. That is the best thing that we have right now in terms of protecting against particularly severe disease and death due to COVID-19. So really continuing to encourage people to come forward. We've seen an increase in first doses over the last week that have been coming forward, and you can't get your second dose till you've had your first. So very glad to see people coming out and doing that as we move forward. We saw for the couple of days after the proof of vaccination report by the province about a 4% increase in our 7-day average of COVID-19 doses administered. That did fall off again over the long weekend, and usually that is the pattern that we see when we get into a long weekend. There aren't as many people who are coming out to get vaccinated, although very much, as the mayor's already pointed out, very thankful for the turnout at the Lime Ridge event over the weekend. Moving into the fall, we'll be going through implementing these proof of vaccination policies, and just wanted to underscore again that that's absolutely a minimum in terms of what we can do in terms of increasing vaccination rates and protecting all of us against COVID-19. You'll know last week as well, I strongly recommended that all businesses look at their own operations from both a staff and a public perspective, do that risk assessment, look at what the risk factors might be there, and adopt immunization policies for their staff and for the people who attend at those settings. So very important that each of us take a look at what we can do, how we can improve vaccination rates, and protect both ourselves, our loved ones, and those who attend at our businesses. We are very much in the midst of the last mile strategy, as the province coined it, and we are continuing to go out to places where people are and leveraging our relationships with community organizations. We have, of course, had a priority ongoing in terms of targeting those who are disproportionately affected by COVID-19 to reduce as much as possible their barriers to accessing a vaccine. So we're doing place-based clinics on site in apartment buildings, for example, to areas in areas of disproportionate impact. We've been reaching out to higher risk workplaces as well to offer on-site workplace clinics. And so any workplace that is interested in moving forward that, we'd be very happy to talk to you. You can just reach out to our PHS email address in order to talk more about that. As well, we do know as we go forward, just overall in looking at new data that Public Health Ontario had put out, that we are seeing that those cases that are continuing to occur happen in those who are unvaccinated. 94.1% of our cases since December have been in unvaccinated individuals. Only 1.1% have been in fully vaccinated individuals and 4.8% in partially vaccinated individuals. And of course, we know that the risk of serious disease or death is reduced significantly through the vaccine. We will continue to set up mobile clinics throughout the community. We have, of course, the GoVax buses and our colleagues from the ministry helping as well with clinics, and you'll see these hyper-local clinics throughout the community. Looking forward, we'll have some places such as the Open Street Spartan that we were at, I should say, and the clinic at Bernie Morelli yesterday at the Labor Day Classic, but going forward at Eva Rothwell Center in the heart of the Keith neighborhood, at the Neighbor to Neighbor Center, at the Binbrook and Ancaster fairs, and anybody can walk into any of these clinics that are PHS run in order to get a first or a second dose of vaccine. There's another 20 mobile clinics that are scheduled throughout this month at schools throughout Hamilton. And each of those clinics in the schools will serve any of those students, families, staff that both belong to those secondary schools where the clinics are being held, as well as the feeder schools at the elementary level. So as we head back to school tomorrow with that top of our mind, and I'm sure people are very pleased to see kids head back to school and getting back to what they need to do from a mental health, social, developmental perspective. We absolutely want to see them in school, see them stay in school. And so as we have done since the beginning of the pandemic, we'll be continuing to work collaboratively with all of our school boards to support the Ministry of Education's recommended health and safety measures. And we're pleased to see that our local boards are adopting as well some enhanced safety measures as we go forward into the school year. Back to you, Mr. Mayor.
All right, thank you, Jason. Thank you, Dr. Elizabeth. And everything that we are doing is to protect our residents and beat this virus. And you can go to hamilton.ca, get your vaccine. If you want to know locations on where you can get your vaccine, there are numerous opportunities for you to do so. It is important to remember, though, that we are still in step 3 of the roadmap to reopen, and we expect to stay here for a while. So as we move into the first week of school and as fall approaches, we will be spending more time indoors. So it's important for all community members to protect themselves and their loved ones and get their first dose and second dose of COVID-19 vaccine. Masking and physical separating is still something that you should be mindful of as you cautiously navigate our community, knowing that the Delta variant is out there and can be very infectious and potentially very harmful and deadly. So I want to encourage also employers to address and put in place a COVID-19 workplace vaccination policy that will help protect your employees and your patrons. I know that all large employers, or all employees, quite frankly, have a responsibility and a duty to protect their employees and the people that come to visit you. So I would think that you'd want to be eager to put some policy in place. And you know, we have seen the devastating effects of the pandemic, and that it has had on our local businesses and families, and understandable the challenges that we continue to face there. Although it's better today than it has been, it's still a challenge that we collectively face, and we certainly continue to look for our federal and provincial partners to help and assist us as we work through these very challenging Delta variant times in the fourth wave. So with that, I'm going to turn it over to Jasmine for some questions from the media. Jasmine.
Great. Thank you, Mr. Mayor. We have 3 media joining us for the briefing today. As usual, we'll start with 1 question and 1 follow-up for everybody. Our first question will be to Manisa from CHCH. Manisa, you can go ahead.
Thank you for taking my question. My question is actually for Dr. Elizabeth Richardson. So there's already one Catholic school in Hamilton is reporting an outbreak right now. And I was wondering, in what situation do you think public health will make the decision of closing schools down?
Thanks, Manisa. Yes, unfortunately, we do have one school already that has an outbreak as we are moving into the school year, and we're going to continue to see outbreaks as we go forward through the fall. The reality is that what happens in our schools is going to reflect what's happening in our community, and so we can expect to see that as we go forward. That said, we are doing everything we can to, with the school boards, taking the lead in keeping our kids in school rather than having us come out of the school setting. And you've heard from the Chief Medical Officer of Health, from Kieran Moore, that he doesn't see a situation in which we're actually going to have to close down schools, in terms of a full school board wide closure. There may be times where there are classes that are dismissed, or it might be a very short closure for operational reasons of a particular school because of what is going on there. But we'll all be doing everything that we can to make sure that that's not something that happens this year.
Thank you. And can you outline the difference in protocols between unvaccinated and vaccinated students in school for both the Catholic and public school boards when they're exposed to a confirmed COVID-19 case? What are students who are vaccinated supposed to do as opposed to students who are unvaccinated?
So, Manisa, you're right to point out that there are some differences in terms of how we move through things depending on whether students are vaccinated or unvaccinated. Rather than go through all those details here, that's probably something we're better able to give you. I've got a number of charts that relate to the school boards and how we move forward with things. And so that kind of detailed answer is really best suited to something we can provide you in writing.
Great. Thank you, Dr. Richardson. We'll go next to Sebastian from the Hamilton Spectator. Sebastian, you can go ahead.
Thanks for taking my questions. This is for Dr. Elizabeth Richardson. I know you kind of mentioned it earlier, but I was hoping you could be a bit more specific about the city's inoculation uptake in the wake of the vaccine passport announcement. Can you give us some numbers on how many doses have been given out since that announcement, and are you encouraged?
Thanks, Sebastian. So we had about a 4% increase. We're giving out right now just under 7,000 doses per week, roughly. And we saw about a 4% increase after the announcement on those 2 days that followed. Then we went into a long weekend, which we see continuously throughout the vaccination times, whether it was May, July, August, each of the long weekends, we do see a dip. So we're really looking forward to see where we get to from here, and would want to see those vaccination numbers continue to rise.
Okay, thanks. And you mentioned the outbreaks at these banquet halls. Are these tied to single events, that is, say, one wedding, or are these multiple weddings? And are you in touch with the operators of these halls to ensure that proper public health guidelines are enforced?
Yeah, thanks, Sebastian. We had a good discussion about that actually just this morning, about revisiting how we move through and making sure that we are notifying the appropriate people the appropriate ways about these vaccines from a public communications perspective. Behind the scenes, in our outbreak investigations, we do go through with each operator, what has happened, what has been their experience. They've been great in providing, the necessary lists in terms of contacts that we can get a hold of. These are events, these are outbreaks that have occurred in relation to a single event. And that's why we thought it was really important to point that out on our website, that while these may be occurring at a banquet center, they are amongst those that are attending and are not things that have happened more broadly within those centers. It also helps from the standpoint of making sure all of the contacts have been notified. These tend to be large events, and it can be very, it takes a lot of time for our staff to go through and contact people in a timely way. So getting the information out there in other ways is another way we can make sure that everybody is aware of what might have happened.
Great. Thank you, Dr. Richardson. Our next question is to Bobby from CBC Hamilton. Bobby, you can go ahead.
Thank you very much. I hope everyone had a great weekend, a great long weekend. My first question is for Mr. Thorne. I'm just looking at the enforcement page here, and it looks like some places, I'm looking at a restaurant, Born and Raised, 1, 2, 3, 4, 5, looks like RAO offenses. I'm just curious, when bylaw officers are going to these locations, I mean, before, I think we would hear things like businesses saying they didn't know what the rules were, that sort of thing. What are we hearing now? I just like to know, I'm sure other people would want to know how these violations are still occurring into this fourth wave here.
So thank you for the question. We still do hear some of that. We still do hear some of that the the businesses aren't aware of the rules or that the rules have changed. We do continue to do a fair bit of education, but I would say that for people in the restaurant industry, these rules have been in place for a period of time, and we are in this point now in enforcement. We are laying charges, and so you did see that on the weekend with 5 charges raised at 5 charges issued at Born and Raised for a variety of infractions. It's our expectation that businesses should know what those rules are, and most do. We did have a number of charges this weekend, but we go to a lot of businesses, and for the most part, we still do see very good compliance. But where we don't see it, we are proceeding to charges.
Thank you very much. And Dr. Richardson, in terms of our vaccination rates right now, I missed a bit of what you were saying. I joined a little late. I'm sorry for that. But I wonder, are there any sort of new strategies that we're looking at to try to boost the rates? Because, you know, they still are pretty low.
Thanks, Bobby. I might just tag on to Jason's question too, if you don't mind. In terms of the enforcement, continues to be a significant part. We did seem to see when we were doing our outbreak investigations that some people, you know, I think as we were heading into step 3, some people thought we were coming all the way out in terms of heading into the exit from the roadmap. And there may have been a little bit of backtracking that needed to happen. And so we're very glad for our colleagues in municipal law enforcement being out there, reminding people, and indeed, you know, having unfortunately to lay some charges in relation to this. But very important that we remember that we are still in step 3, and we need to be compliant with step 3 as we go forward. That's been one of our concerns as we're doing outbreak investigations as well. In terms of the vaccine coverage, we're sitting at 80.6% for Hamilton having first dose, for Hamiltonians having had a first dose, and 73.3% for those born in 2009 later that are fully vaccinated. And while we are at a lower end across the spectrum in Ontario in terms of vaccination rates, you know, the spread isn't that great. But and we're all moving forward. Certainly some of the key factors we've seen have been, you know, the length of time that the vaccine has been available to different groups across Ontario in terms of what we're seeing in terms of coverage rates. So we continue to work with all of our areas. We've now got this focused group on the what we call census tracts that have the lower vaccine coverage, that beyond the FSA level, to really focus in on those communities. That's one of the things that we've been doing and doing differently. Some of the things we're doing that's the same is working with all of the community partners who work with those who may not have been vaccinated yet. When we're out talking to people, we often find that there's multiple reasons why they may not have gotten vaccinated. It could be because it's, you know, very challenging for them to get out with having to work a couple of different jobs. It may be that it's issues around looking after their kids, or just that they have so many other things that they're needing to tend to in their day-to-day life. For some, of course, it is again about having access to people who they can talk to about vaccines, whether it's their family doctor or they may not have a family doctor, in which case they're welcome to call us on our public health hotline and talk those things through a little bit further. So we continue to work with everybody around those. One of the things we did do was shift away from those large scale clinics, with St. Joseph's Hospital's clinic shutting down this past weekend, and move to these multiple sites that are across all of the communities. So you now see our school-based sites that have been operating now for a couple of weeks. You've seen, again, some of those new GoVax buses underway, and we had some of the highest turnouts in the province to those GoVax bus sites. We just this weekend started our own bus up and are getting that going out there. We're going to fairs, as you heard. We're going to be at Ancaster and Rockton. So we're trying to go absolutely where people are and make it very, very convenient for people to be vaccinated, to make sure we're connecting with as many people as we possibly can, and try to make vaccine information and the vaccine itself as accessible as we can.
Thank you, Dr. Richardson. We have a bit more time, so we'll go through for one more question each. First, we'll be back to Manisa. If you'd like another question, Manisa, you can go ahead.
I'm okay, thank you.
Great, thank you. We'll go next to Sebastian. Sebastian, if you'd like another question, you can go ahead.
Another for Dr. Richardson. Have you guys discussed having any goals in terms of the daily vaccine doses administered? Do you have a...
Sorry, Sebastian, you're just cutting up a little bit there, breaking up a little bit, but I think what you're getting at was daily goals in terms of vaccines going out and being administered. So we do have a goal in terms of vaccination coverage. We want that above 90% doubly vaccinated for all those that are eligible. In terms of our different FSAs across the province, or across the community, I mean, it is 75% and above for every single FSA to be doubly vaccinated, and we'll continue to look at those goals. From the standpoint of getting the vaccine out there, we are just getting out as much as we can, very much like the pharmacy channel. And of course, that 7,000 doses I spoke to doesn't include the pharmacy channel. That's just the ones coming through our clinics. And we know the pharmacies are doing really good work as well in terms of getting the vaccines out there. We're all just having as much on hand as we possibly can, and offering it and reaching out to as many people as we can. So we'd like to see the numbers be even higher than that 7,000 a day. We were very happy at Lime Ridge when our staff had to go back a couple of times to the vaccine refrigerators to get more vaccine from where it's stored. So that's the kind of news we want to hear from our staff, is that they stayed on late on Sunday and had lots of people turning out. And that's the way we approach it. As long as there are people there, we'll be there to provide the vaccine.
Great, thank you. We'll go back to Bobby from CBC Hamilton. Bobby, if you'd like another question, you can go ahead.
I'd love another question. Thank you very much. My question for Dr. Richardson. When the pandemic started and we were talking about vaccination, I feel like a lot of what we were hearing was kind of people need to come and get their vaccines. They need to come out and get vaccinated. And when we ask about vaccination now, it sounds like we have this approach where instead of waiting for people to come to us, we're going to them and bringing the vaccination to them. We had a lot of community leaders saying, though, since the start of the pandemic, that there are some communities with access issues, and they can't just think about a vaccination. They're trying to just get by and do their job. When did our strategy shift, and why didn't we think of that earlier?
Thanks, Bobby. That's a very good question in terms of looking at our strategy, and I think there's two different pieces to it. One was early on in the vaccine strategy that the province was rolling out. They were very targeted to those who were older and those who were the healthcare professionals working in the higher risk settings. And so we were out targeting those in long-term care homes, retirement homes. We were into our RCFs as well in terms of people who are at higher risk. And we were at the same time vaccinating all of those from a healthcare setting. As we started to open up beyond those ages, we also started to look at working with our communities even more closely. We started working with them back in December, even before the vaccine was available to us, but began actually getting out on the street with those groups, encouraging them to take up the vaccine, get registered, get the vaccine out there. You'll recall that we actually did some of that work with Shelter Health Network quite early on because of the concerns we had in terms of the shelters and the homeless population. And so we, earlier than across the province, did release that vaccine to that group to get that out there. We also started the targeted FSAs and went beyond the ones that the province had actually recommended that we targeted, and targeted all the ones that we saw that were higher with mobile clinics in those settings, again, in conversation with our partners, and again, encouraging our partners to look at how they could take up the vaccine and be part of that. And so you saw some of the community health centers that serve these populations being partners with us on these. And as well, we opened up very early to our Black and racialized community. I know that was quite controversial at the time, but that was certainly a high-risk group that we've been seeing lots of COVID cases in. And we knew, again, as you pointed out, we're concerned about the vaccine. We're going to take a little bit more time. Very important to work with people that they trusted in terms of our community partners in order to encourage vaccination. So we actually changed that strategy quite early on in terms of getting it out to people in the settings where they were through our mobile stream and with our partners. And then ultimately now, as you've seen, we've shifted all the way so that all of our vaccination program is happening on that very local, smaller scale clinics. It was very important for us through those initial days to move as much as possible in getting vaccine out. So we had that mixed model with the larger and the smaller mobile clinics.
Thank you.
Great. Thank you, Dr. Richardson. Mr. Mayor, that's the end of our media questions for today. So we'll pass things back to you.
Thank you very much. And just to follow on that, I think Bobby will remember that for the longest time through COVID, we were limited in terms of supply, which meant that we had to prioritize certain areas and certainly open them up as quickly as we could going forward. So thank you, Jasmine, and thank you, Bill Custers and the entire team at Cable 14 and Clear Cable, as well as our media partners out there that are sharing this information with our broader community on an ongoing basis. We really appreciate your efforts. And for more information on COVID-19, the financial supports and any updates, you can visit our website at hamilton.ca/coronavirus. And please continue to follow all the public health measures and get your vaccine as soon as you can. It is important that you do, and it's good to see that more and more people are taking up the vaccination challenge. You can find the latest information on the vaccines, as I mentioned earlier, at hamilton.ca/coronavirus for all the locations as to where you can get your vaccine today. And they are numerable and they are easy, and you have a choice of Pfizer and Moderna. That's it for today. We'll see you in the next couple of weeks. Stay well, enjoy the weather, and we'll see you soon.